Anabolic steroid use psychological effects. Anabolic steroids, also known as anabolic androgenic steroids or AAS, are synthetic derivatives of the male sex hormone testosterone that have been modified in order to enhance anabolic actions such as the promotion of protein synthesis and muscle growth. These drugs are often illegally self-administered by athletes, especially bodylifters and powerlifters, to improve their sporting performance by increasing body weight, fat-free mass, muscle size, and strength. However, a recent study by Sejokvis, Gali, and Rain discussed the use of doping agents, in particular anabolic androgenic steroids. It mentioned how AAS has changed from being a problem only in sports to now being one of public health concern as well. Anabolic steroids have been used since the 1950s to improve predominantly male physical attractiveness and athletic performance. Amsterdam et al. Found that occasionally anabolic steroid use can be linked to certain psychological and social traits of the individual. The most common traits were low self-esteem, low self-confidence, suffered hostility, childhood conduct disorder, and tendency to high-risk behavior. Although it is believed by some that there is a beneficial impact on sporting performance due to AAS use, it has also been found that there are both positive and negative psychological effects of this substance use. Although anabolic steroids are typically looked at in a negative way due to the media, it can be found through research that there are some positive psychological effects of its use. However, it was definitely very difficult to find information on the positive psychological effects of anabolic steroid use, as most articles tend to focus on the negative factors. An article by Kaneyama, Hudson, and Pope discussed the point that not all anabolic steroid abusers are elite athletes like those exposed in the media. In fact, some are not competitive athletes at all. Nonetheless, most individuals who use anabolic steroids experience both positive and negative psychological effects. Although many articles often refer to aggression as being a negative psychological effect of anabolic steroid use, an article by Mazzeo et al. Had a different perspective. They looked at aggression as a way of making an individual have a more determined attitude, particularly in sports where physical contact with opponents is necessary. It was also found that whilst actually using anabolic steroids, individuals often experience positive mood changes such as euphoria, increased energy levels, and enhanced libido. The use of anabolic steroids affects the amount of hormones released, such as serotonin and dopamine. Due to the increased levels of dopamine in the body, similar characteristics to the effect of amphetamines can be present. This means the anabolic steroids firstly act on intellect by causing the increased production of dopamine, resulting in the users developing a sense of euphoria, which originally provides them with a state of wellness, happiness, and helps them to maintain focus and motivation during workouts without feeling fatigue. These are all psychological factors that cause the users to be happier and more comfortable with themselves whilst using anabolic steroids. According to an article by Vassallo and Ulrich, an aspect of psychological functioning of AAS use is the user's perceptions of self-confidence. It has been seen in many studies that self-confidence of individuals often increases whilst ingesting or injecting anabolic steroids. In this case, it was found that AAS use can in fact lead to benefits such as positively impacted levels of not only self-confidence, but also increased levels of perceived athletic prowess and increased levels of academic performance. Therefore, it's not really surprising that there are so many individuals around the world using anabolic steroids if they are receiving positive effects such as this. However, this then leads on to the negative side of things, which is AAS dependence and other negative psychological effects of AAS use. Kaneyama et al. Stated, this larger but less visible population of ordinary AAS users began to emerge in about 1980. The senior members of this population are now entering middle age. They represent the leading wave of a new type of aging former substance abusers, with specific medical and psychiatric effects. According to Mazzeo et al., over time, the original feelings of euphoria experienced when first using anabolic steroids can turn into aggression, and can change over to antisocial behavior. The study by Kaneyama et al. Found that there also appears to be a connection between anabolic steroid use and a wide range of potentially prolonged psychiatric effects, such as mood syndromes, dependence syndromes, and progression to other forms of substance abuse. With that said though, it remains poorly understood as to the severity and prevalence of these different psychiatric effects. Due to anabolic steroid use overwhelming the male pituitary gland from its androgenic effects, it theoretically causes hypogonadism during withdrawal from the drug. The desire to restart AAS use is often seen in individuals who are experiencing persistent dysphoric effects or major depression, therefore leading to the problem of AAS dependence. This may require treatment to reactivate the neuroendocrine function and antidepressant therapies for those whose depression is non-responsive to endocrine treatments alone. The acute effects of anabolic steroid use on mental health was described in an article by Lindqvist, Moberg, Erickson, Ernborg, Rosen, and Falk. Some examples of negative side effects they discussed were increased aggression and irritability, anxiety and depressive symptoms, suicidal behaviors, cognitive impairments, and hypomanic symptoms. Research showed that athletes who used AAS for longer than a 2-year period had increased reports of seeking professional help for psychological problems such as irritation, anxiety, and anger. They also seemed to be more likely to combine the use of alcohol and illicit drugs with anabolic steroid use. This explains why individuals who consumed higher amounts of AAS have reported more experience of side effects than those who only used for less than 2 years. With this being said, it is still unclear as to whether anabolic steroid use is completely responsible for these psychiatric attributes, or if personality traits have something to do with it as well. Amsterdam et al. Stated, abuse of AAS is associated with behavioral and psychiatric effects which vary from still socially acceptable mild irritation and body training drive to uncontrolled aggression, hostility, and even depression and mania. The occurrence of these effects is usually minimal and depends mainly on the dosage amount used. The study also found that it is quite difficult to distinguish whether these psychiatric effects are caused by the use of anabolic steroids or by underlying psychosocial factors and personality traits of the particular individual. It was mentioned that antisocial, narcissistic, and histrionic traits are common in chronic anabolic steroid users. However, according to Amsterdam et al., many studies have indicated that the dosage of AAS that an individual is ingesting or injecting could possibly be the cause of hypomanic or manic symptoms that can occasionally be associated with violence and aggression. Then again, as mentioned earlier, not all studies have proven that such side effects are directly related to anabolic steroid use. Overall, it can be said that the possible psychological effects of anabolic steroid use are controversial, and further study in this area would be beneficial. However, from the information that was obtained, there was definitely more emphasis on the negative psychological effects of anabolic steroid use, although there was still a small amount of positive effects found. Therefore, when looking at anabolic steroid use as a whole, it can be seen that there are both positive and negative psychological effects.